Hello, everyone. This is Abdul Chowdhury from Starling Diagnostics. Today, I'm here with Dr. Nawaz Hussain, our primary care specialist, obesity specialist, as well as the medical director. Welcome. So today we are going to talk about arthritis. Okay, what is arthritis? How can we manage it? Is it easy to manage, and so on and so forth? So, Dr. Nawaz.
Hello. So, in order to understand arthritis, we have to understand what happens during arthritis. So, arthritis is inflammation of the joints. So, what inflammation means, the joint swells up. There's it feels hot, and then it is painful. The joint stiffens. So that's because of inflammation. So there's about more than 100 different types of arthritis. So most common that we deal with is osteoarthritis. So osteoarthritis is, usually happens to people with age, and then also it's weight related. And it's kind of like wear and tear of the joints
Over time. So most of the people who are elderly or older.
Yeah, usually.
Right.
It's also if there's like injuries to the joints that can lead to osteoarthritis. What happens is that there's cartilage in between the joints, and then over time, because of injury or because of wear and tear, the cartilage wears off, and then you have bone on bone, and because of the friction, it causes inflammation. That's what osteoarthritis is. There's other arthritis like rheumatoid arthritis, which is an autoimmune problem. Your body produces antibodies that attacks the joints, that causes inflammation. So that's a rheumatoid arthritis. And then there's lupus. Lupus is also an autoimmune problem.
And some of them are genetic AF.
It's some genetic link also. And then there's it's a systemic disease because it attacks almost throughout the whole body. You can.
It kind of is it like spreads?
Yeah. Well, it affects different types of different parts of the body. So it can affect the skin, can affect the kidney, the heart, even the brain can be affected. Then there's psoriatic arthritis. These are the people with like psoriasis. It's a skin lesion. That's also an autoimmune problem. You have skin lesions, and then over time, like 30% of them develop psoriatic arthritis. Then there's gout arthritis. You have increased uric acid in the blood that deposits in the joints,
Right.
and forms crystal and forms it causes extreme pain in some joints, like usually the toes or the knees or the elbows. Then there's fibromyalgia. Fibromyalgia is like a hyperactive nervous system, meaning the pain is excruciating compared to normal people. For example, if you feel something causes you little pain, for them it'll be extreme pain. Okay, and they have pain all over, involving the muscles and the joints. So that's fibromyalgia.
Right.
So there's so many
Different
other different types of
excuse me. Does women or men has anything to do with, does women get more arthritis, prone to?
Yeah, so some arthritis are more common in female, like lupus is more common for female, rheumatoid arthritis is more common in female, and men are, gout is more common in men. Yeah, so there are some differences.
So what do you, how do you determine a person has arthritis or not?
Yeah, so they'll have painful joints. It could be the knees, the hip, or the elbows, or the ankles. They swell up. They stiff. They'll complain about morning stiffness. They're usually So like osteoarthritis, you have morning stiffness, but it gets worse throughout the day. And rheumatoid arthritis, on the other hand, is bilateral, meaning both hands could be involved. It's never just one single joint. So rheumatoid arthritis,
Multiple joints.
Yeah, multiple joints. It happens. You have morning stiffness. But it gets better after an hour or two.
Right.
Usually it happens on the wrist or the finger joints, or it can happen.
So in the day progresses, it gets better.
Yeah, for rheumatoid arthritis, yes. So there's different arthritis presents differently.
How does diet plays? Does diet have anything to do with what kind of food you're eating, your lifestyle?
Right. So osteoarthritis is associated with obesity also. So because of overweight, there's more stress on the knee joints or the hips, so they get injured over time, causing osteoarthritis. Diet, research has shown food with high fat content or a high carbohydrate content can cause inflammation of the in your body that causes injuries to the joints. So there are food that causes inflammation. There are food that decreases the inflammation in the body. So like Mediterranean diet has shown to decrease the inflammation of
We talked about it,
the body,
and that has to do with your stomach lining. That has to do with obesity.
So Mediterranean diet has a lot of benefits, and that involves like a Mediterranean diet is like fruits, vegetables, and nuts, grains. There are sweetened drinks like soda, ice cream, candies. This stuff can worsen arthritis. Certain type of oil that we use, like vegetable oils like corn oil, soybean oil, those can worsen the joint pains. Like olive oil is better because certain oils have like more omega-6 compared to omega-3.
Understood.
So these vegetable oils have more omega-6, which causes more harm to the
Understood. So different things. So how does exercise plays on this? Like a lot of people complains, if I have arthritis, I'm not able to walk properly, I'm not able to run properly. So it's like a catch-22, it seems like.
Yeah, so exercise is the number one recommendation for any type of arthritis also, because not only it helps you lose the weight and less stress on the joints, it also makes your muscles stronger around the joints, stabilizes the joints.
So you have less pressure on your joint.
Yeah. When you have stability of the joint is very important. So muscle strength is important to stabilize the joint. And the normal recommendation is to do 30 minutes of moderate intensity exercise, which is like brisk walking or biking, or like swimming, water activities. These are recommended. So 30 minutes every day, 5 days a week. So 150 minutes total. That's the recommendation.
So, most people complain about their knees first, especially when you're overweight or on the obesity line. Then you're gradually going to develop arthritis in your knees, and that's going to get worse.
Right. Obesity definitely leads to a knee problem, and then over time, you may even need surgery if the pain and exercise and the physical therapy, if they don't help.
What are the tests do you guys do when people come in complaining about this?
So first thing to do is X-rays. Obviously, if there's any inflammation of the joints that's suspected, then you do X-rays. If you're suspecting like some autoimmune problem, there will be other blood tests to do to check for the osteoarthritis. And then if X-rays might show this fluid in the joint, sometimes, because of the inflammation you develop fluid in the joint. That makes the joint movement even more difficult.
Right.
Sometimes you have to get the fluid out with a syringe. You have to go to the orthopedic doctor. They'll take the fluid out. That may make it better. And then sometimes you may need steroid injection to help with the pain. And if all of this fails, then final recommendation would be to do surgery. Surgery replacement.
So can you talk a little bit about our back pain is a very common one, right? A lot of people would say, "Oh, my disc, I have disc herniation." Can you talk about it a little bit?
Yeah. So disc herniation is not really arthritis, but there are degenerative joint disease that leads to arthritis, and then that causes maybe disc herniation. And disc herniation, in the spinal cord, you have some gel-like structure in between the bones. And then sometimes slips out and puts pressure on the nerves, and that causes pain. So that's disc herniation. Usually, if you're doing heavy lifting or if you get injured, like in a car crash or some type of injury, that can cause the disc to herniate out.
Right. What recommend? So you if you have a patient who you determine they may have arthritis, you recommend to orthopedics.
Yeah, so for first they have to go to the orthopedics, or their primary care doctor can do X-rays and then find out if there's any arthritis, if there's any other workup needed for blood tests, that would be done. And then some people may require MRI also to get a better look. And then usually pain medication with like ibuprofen, NSAIDs, like anti-inflammatory medication, and then physical therapy would be the next.
So first physical therapy, worst case scenario, your surgery, but the surgery doesn't necessarily mean that you're going to be fine, but after the surgery, you still have to manage.
Lifestyle changes has to be there, okay? So you have to lose the weight. Even after surgery, you have to maintain a certain diet, because, there are certain foods that cause inflammation, and so you have to follow a certain type of diet.
What other recommendations would you give to younger people? Like, I know that a lot of younger people, they just go to the gym and then suddenly they're exercising like crazy, to get that desired muscle, whatnot.
Yeah.
And if you're not doing the right form, over time, when you're in 40 or 40s, 50s, you kind of develop.
Definitely to know the right form of exercise, because joint stability is the key Always if you're doing deadlifting or whatever, so you have to look at the right form, because it could, you could injure the muscle, the joint, or the tendons, a lot of things can happen.
Which is going to affect you. You may not see it now just because, your cell is new, basically, right? Your body's new.
Right.
So once you're 30s, 40s, 50s, later on,
They
then
can develop.
okay. So any before we end the video, any suggestions you want to add?
No. So the recommendation is if you have pain, a lot of people, they sit home because of the pain and they're not really moving much. So exercise actually helps because it stabilizes the joints. So over time it helps. The beginning is a little bit of difficulty, but over time it helps. So my recommendation would be to.
And a lot of people also, just to
exercise.
add the last thing, a lot of people, if you are not able to run or walk properly, they're doing cycling, they're doing swimming and things like that. So there's always a way. All right, thank you very much. Until next time, and you can always ask us questions or comment on the video, or just give us a call. Thank you.